I think that we are at a juncture where we have the opportunity to really change the way that we do things within our health and care services, and to change the way we are as a society, learning from some of those lessons or some of those changes that have taken place. You know, as I say, the times were dark before. The pandemic has been a very dark time. And now I think is the time when the light can come streaming in if we have the motivation and the determination to make that happen. And I think compassionate leadership, team working, and reflection and learning are important themes.
Good morning, everyone, and welcome to Let's Talk Leadership. I'm Anne Mason-Powell. I'm a senior executive coach and leadership facilitator, and I'm delighted to welcome Professor Michael West to a second edition of Let's Talk Leadership. Welcome, Michael.
Thank you, Anne.
Professor West is, amongst many roles that he has, is Senior Visiting Fellow at the King's Fund and Professor of Organisational Psychology at Lancaster University, and very well placed through his research and interest to talk about compassionate leadership. We did our last episode in June talking about compassionate leadership, and Michael, you presented some very powerful arguments for compassionate leadership, outlined not only the case, but what are the characteristics that people have who are compassionate leadership and practicing in organisations, and really what we need to put in place. So in this conversation, I thought it would be very helpful to get your insights on post-COVID as we are starting to move into the world of work again and take up many of our interests and activities. People are going back to the workplace. What is it that we've learned about compassionate leadership that we can really seek as leaders, individual leaders, organisation leaders? What are the lessons that we can learn that we can take back as we start work again?
So I think first, and thank you for inviting me to join you in this leadership series. I think the first is to just reflect on some of the characteristics and processes that have emerged during the crisis, particularly in our health services. So, and also to recognise that back in January, before the pandemic wave broke, our health services were probably in the darkest place in their history. We had 100,000 staff vacancies, stress levels at their highest that they've been from the time we've been recording stress levels, very high levels of staff turnover, and great difficulties recruiting people, whether we look at nursing staff, doctors, allied health professionals. We were in a very difficult state, the darkest state as I think that the health service had been in. And then the pandemic broke. What we've seen during that time is, of course, great variability, but we've seen the emergence of compassionate leadership, both within and across our health and care systems. We've seen that job titles have become in some way a little bit blurred, and hierarchical boundaries have become more blurred, and even organizational boundaries have become more blurred as people have responded in innovative ways to the pandemic. So we've seen staff, nurses from healthcare go out and work in social care settings to assist when they were needed. We've seen that some of the national bodies in England that oversee, monitor, some would say constrain hospitals, community mental health services, and so on, have in some cases loosened that constraint and taken maybe a more supportive approach. We've seen team working become in a way more embedded during the crisis. So people have tended to work much more in stable teams than they did prior to the pandemic. And there's been a lot more, I think, supportive camaraderie. We've also seen that communication has changed in some ways. It's become more intense in many instances as people have had to come together and make decisions under pressure. So lots more team huddles to discuss issues. And we've seen, of course, the public have changed their role. So in addition to the public going out and clapping on a Thursday evening, what we've seen is people being more cautious about using A&E services, a huge amount of support for health services. So the community supporting by looking after elderly people within the community, 700,000 volunteers from the public working to support the NHS. So we've seen quite a lot of changes that I think have important implications for the future. And I guess I would say, I think that we are at a juncture where we have the opportunity to really change the way that we do things within our health and care services, and to change the way we are as a society, learning from some of those lessons or some of those changes that have taken place. You know, as I say, the times were dark before. The pandemic has been a very dark time. And now I think is the time when the light can come streaming in if we have the motivation and the determination to make that happen. And I think compassionate leadership, team working, and reflection and learning are important themes.
I think I'm very interested in that we've talked quite a bit about compassionate leadership. So I'm quite interested in the teamwork and also the learning. On the teamwork, did I understand it right when you said a couple of the features which seem contrasting to one another? One is that you've seen more stable teams, but you've also seen people working across boundaries. So we've seen a focus in stability of teams where they've had this amazing focus on what needed to be done. But we've also found that people have been pretty flexible and gone where they're needed. Is that right? Have we seen both of those aspects of teamwork?
Yes, we've talked to doctors and nurses, and many of them have told us that they have spent more time with, as it were, a home team. So they've spent more time with the same people than they normally would. Doctors, for example, are often shifting from one ward to another, from one team to another. But there's been more stability. And because of that, they've both felt that they've been able to work more effectively in teams because they've got to know the people they're working with, but also felt a great deal more social support. So it's helped them cope with some of the stresses of the pandemic. And we know that stability of team membership creates more effective teamwork. And as you say, the other development that we've seen is that there has been greater preparedness to work across boundaries, both across boundaries between teams as well as across boundaries with organizations. So we've seen some doctors providing nursing care because their medical skills weren't immediately in demand in the circumstances we faced. And we've seen some primary care nurses going into care homes and providing infection control training. So both of those, I think, are important lessons for how we work effectively in organizations. So working well in teams, we know that teamwork is really important for effectiveness, for innovation, for people's well-being, but often we don't get it right in organizations. And working across boundaries, inter-team working, cross-boundary working is critical for the integration of the work that we're doing in organizations, particularly organizations as complex for healthcare organizations. So I think there's enormous learning from both of those themes for how we work in organizations in the future.
Very interesting. So, and the link I thought was very clear from what you said, Michael, was that actually, if you're focusing on team working, because of all the benefits that it brings to the system, to the individuals, it actually feeds into compassionate leadership. It creates the conditions, the teamwork create the conditions for people to be compassionate and to help one another out and to learn from one another. So there's a nice link there. And also the link with teamwork and innovation, that they're able to be flexible and focused, and that's allowed them to work in quite innovative ways, as well as finding answers together. Is that the link as well?
Yeah, so I think the team is in a way the team is the place where all our policies, all our ideas about leadership and organizations, it's where they really connect with the day-to-day reality of people's work. It's the team I work in that has most influence over my experience of work. It's how we work together that determines how effective we are at delivering in our work. Whether, if we take the example of healthcare, it's how I work with my fellow professionals that determines the quality of care that we're able to give, and it determines patient outcomes. And what teams can do is either create an environment that is toxic. So, for example, where there's interpersonal conflict or where people are striving for control and power in their relationships with colleagues. Those are very toxic work environments that are associated with ineffectiveness in work. Or we can create team climates of psychological safety where people feel that they will be supported by colleagues, where they can speak up without fear of being ridiculed or of put down or of their views being ignored. And where people feel psychologically safe, they are much more likely to develop ideas for new and improved ways of doing things, and for those ideas to be implemented. So we see that compassionate leadership is really important in creating the conditions for psychological safety in teams. And I would include compassionate leadership as the responsibility of every team member. It's not just the hierarchical leader. It's the responsibility of every team member to lead compassionately within the team, because we know that shared leadership in teams predicts team effectiveness, and that compassionate leadership is really central to creating the conditions for innovation. So a lot of our work over the last 5 years has demonstrated how where you have compassionate leadership, then levels of innovation are much higher. And in healthcare, probably more than any other area, developing new and improved ways of doing things to deal with the challenges we face in healthcare is the only strategy, is the only way forward if we're to be successful.
There are so many lessons to be learned, Michael, and thanks for sharing the highlights of those with us. My concern is that everyone is tired. Everyone wants to get back, to a large extent, I think, to the normality that they had before lockdown. You mentioned about the need for reflection and learning. How can we ensure that people do take this time out? They take a pause, stop themselves from running back in their enthusiasm to resume, and then they don't implement this learning. And I understand, of course, that the NHS was one of it was a pioneer of the action learning research and implementing the before and after outcomes. So they're very good at doing reviews, but we also know that it's a system that often doesn't do that. How can we encourage it?
So it's a really, really good question. And I think we can't go back. We're not going to go back to normal. This global pandemic has changed all of us and has changed our society. What we're going forward to, we don't know. We have to, I think, proactively shape what that new normal will be. And I think we have to do that with positivity and hope and determination, and not just kind of passively walk into some new normal that's no better than where we were before. And part of that, I think, is addressing the pathology of being busy, of being productive, of generating more and more money and wealth. And me personally, one of the really wonderful experiences of this past few months, although the context has been one of enormous tragedy and suffering, I've had time to be in my garden, to spend part of many of my days just being surrounded by natural environment, by trees, by being able to watch insects, butterflies, bees, hear the sound of birdsong. And I think many of us have shared that. And those times of stillness in nature, we know, are really good for human well-being and mental health, for our ability to be creative, for our ability to connect more effectively with others, to to relearn, as it were, a sense of presence, to learn to be present rather than always anticipating the future or ruminating about the past. The more time we spend being present, the better our mental health, the more we're able to connect with others, which is fundamental to our well-being. So whether we're spending time in nature or practicing meditation or mindfulness, those times of stillness are really important for us. And I think that's one of the important lessons from lockdown and the pandemic. And at another level, if we think about team working in our organizations, what I've observed in health services over the years is that many teams, from executive teams down to frontline nursing teams, point of care nursing teams, are under pressure. And when the pressure increases, they simply spin the hamster wheel ever faster. We started researching this back in the early 1990s. What happens when teams take time out rather than just spinning the hamster wheels faster? When they take time out to review what it is they're trying to do and how they're going about it, whether that's a 10-minute break at the in the middle of the day, whether it's 10 minutes before the start of a shift to review what their priorities will be, or whether it's at the end of surgery reviewing what did we expect to happen, what did happen, what didn't happen, what can we learn from this, or it's an executive team or a community mental health team having an away day. What we find is that teams that do that are much more productive and much more innovative than teams that don't, and the well-being of their team members is much better. So a meta-analysis, not so recent actually, 2013, I think it was published by Tannenbaum and Carasoli in Human Factors, brought together all of the data from 49 separate published studies of team debriefs and after-action reviews, and showed that teams that do that are on average between 35 and 40% more productive. So part of our learning has to be to bring this knowledge into our organizations so that, rather than taking time out, debriefs, times of stillness, reflection, being seen as a kind of not particularly important luxury, it's essential. And all of the data we've gathered on organizations in many sectors over the last 30, 40 years has shown that organizations that have climates or cultures where they reflect rather than just spin the hamster wheel ever faster are again much more innovative and much more productive. So I think there's a deep truth about humanity here, is that I think our organizations have become quite pathological in the way that they operate. So instead of taking the time to stop, whether it's as individuals, whether it's as teams, whether it's as organizations, taking the time to stop and reflect and be present is a fundamentally important lesson for the future.
I think that's so true. And at Let's Talk Leadership, we've got some very powerful schemes, we hope, to support young leaders in doing exactly that. So the focus is at the moment more on the individual leader being the best leader they can be, and through a process of coaching and mentoring, taking time out to reflect on where they are, what's worked, what hasn't worked, indeed what they want in terms of joy and impact and success for themselves in the future. So that's definitely an important part of the work we do. Do you think we need to do any more to encourage the young leaders? That's very much our focus, to be courageous and to challenge the systems they go in, to stop and pause, to be more compassionate, to think about the entire system. Is that something we need to do more of in respect of young people?
Yes.
Because now's the opportunity, potentially, isn't it? Them coming up with all their enthusiasm and new ideas.
Yes. I talked about the times being dark back in January. They were dark in a much broader sense, because I think, we've experienced an existential crisis in this pandemic, but we were already in the middle of another existential crisis, which is the damage we're doing to our planet. We are ripping the resources out of our planet, particularly over the last 200 years. and just ripping them out and using them to create material wealth, and to waste a lot of those resources in terms of the food we produce, or all of the products that we produce. And that's not a sustainable future for the planet or other species, or us indeed. And so the pandemic, in a way, I think has created an opportunity for us to think about how we respond to an existential challenge, and in a way is a preparation for how we respond to the existential challenge of climate change. And that's a particular responsibility for all leaders, wherever they find themselves. And I think maybe what we need to do to support young leaders who are developing their leadership is to give them the space to reflect on what their vision is in terms of the contribution they wish to make and the difference they wish to make, to help them reflect on how they can work most effectively with others, how they can help others influence decision-making to ensure that there's a sense of collective leadership, to help them reflect on the quality of the contribution that they'll make as leaders and in what domains, and to give them the courage to develop innovations, because the only solution as we go forward is to innovate. I mean, it's what we've always done as human beings, but innovation is more important now than ever before. So I think it's really important that we create the space for young leaders to think about those four areas, about a vision of the contribution they want to make, of how they will work with others, of how they will ensure high quality excellence in what they do, and how they can create the conditions for innovation.
I think that's a super structure, Michael, very powerful for our listeners. And I was thinking that for me, what's just come out of what you said is how important it is to give a voice. That's the theme, I think, that we've been talking about today, and on part one is critical to the future of our planet, of our health and well-being, is that each of us has a voice, and that we're given opportunity and space to act on the voice, and we feel like we have agency, that it will be listened to, not always accepted. But that what I'm doing, I think, in a very practical way in my work, what you're providing so much of the expertise and research views on, is how best can we make systems work and give everybody a voice and a sense of pride and power within their system.
Yeah, and I think that goes back to compassionate leadership and the role, and I think the most important skill of a leader, and it's the first, if you like, behavioral principle of compassionate leadership, is being present with each other and listening with fascination. So we give people a voice by listening to them. And I think leaders, especially when they're not very confident, often think that their role is to say amazing things, to provide the direction. But actually, I think that the first principle of great leadership is listening, and not listening in a tokenistic way or wanting to appear to be listening, but just it's about practicing being present with the other.
Yes.
And listening deeply, not just the words that people are saying, but to the underlying message. And that's how I think as leaders, we give everybody voice, and thereby draw on the knowledge and skills and experience and ability of all of those we lead, so that our decision-making is powerfully improved. I remember, for me as a leader, I remember the first time I was leading an executive team, was running a business school in a university, and learning that with a group of very able people in a management team, we made decisions much more quickly when I took the time to make sure everybody was able to make a contribution. And one of the things I used to do was to ask people who I knew had expertise in a particular area, who were maybe being quiet, to ask them what their views were. And actually, we came to decisions, good decisions, I think, much more quickly. through that kind of participative process than we did when people were simply trying to argue for their own positions and not listening to each other. And that's something I think a leader must model for those they lead, not only listening to those we lead, but modeling for them the importance of listening to each other in how we work. And what that does, I think, is to create a sense of connection. So the more we listen to each other, the more connected we feel with each other. And that connection builds trust and builds a sense of belonging. And that's a space, a safe space from within which we're able to experiment with new ideas, to try out ideas that, might seem ridiculous at first pass, to create the safe conditions that enable us to develop the radical solutions that we need to the challenges that face us.
And of course, the reverse is true. Without that space, without the voice, we are condemned really to make the same mistakes all over again, and to not learn from our experience and the very rich insights that we've all gained at so many different levels. Michael, that's just so helpful. I think it's taken us to another level of insight in terms of what compassionate leadership means and what each of us and of all of us can do and probably should do as well in order to make our world a better place and to truly show that we're adaptive human beings who can learn and be intelligent about our experiences in the world. So is there anything you'd like to say, Michael, on closing? Any final tip for us?
Well, first, just to say thank you to you, Anne. Your questions are really helpful, and it's a pleasure talking with you about these issues. And so I really enjoy the conversation with you.
Thank you.
I think my tip is that all of this begins with our relationship with ourselves, that actually if we can be self-compassionate, so paying attention to ourselves and caring for ourselves, this is not about feeling sorry for myself or not taking responsibility for inappropriate actions. It's just a basic orientation of compassion towards self, understanding the challenges I face, caring for myself, and then taking wise action to help myself be who I can be. That relationship with ourselves is the basis for our relationship with others. So I think the more we learn to be compassionate with ourselves, the better able we are as leaders to connect authentically, openly with others, with humility, with gratitude and appreciation and optimism. So that relationship with ourselves, which I think we can develop best in those times of quiet and solitude, is, I think, the springboard for us developing authentic, open, appreciative relationships with those that we lead. And that, I believe, is the starting place.
Start with ourselves. Michael, thank you so much. As always, it's been a delight talking to you, and I look forward to working with you in the future. Thank you so much for your insights. And I'm enthusiastic now to use our discussion to support the work that we do with young leaders and leaders at all levels and in all disciplines. And it's so great to hear you making it so very personal and putting it into the hands of people that they can control and change things. I think that's hugely important in the work we all do. So, Michael, thank you, and look forward to working with you again.
Thank you.
Thank you. Thank you, Michael. Bye-bye.